Welcome to Flourish Nursing Academy. I am still your favorite tutor, Godwin. Continuing with Part 3 of antibiotics, we will begin here with glycopeptides, e.g., vancomycin, teicoplanin. These antibiotics are effective principally against gram-positive cocci. This class of drugs inhibit the synthesis of cell walls in susceptible microbes by inhibiting peptidoglycan synthesis. Vancomycin is used if infection with methicillin-resistant Staphylococcus aureus, MRSA, is suspected. Due to their toxicity, use of glycopeptides, antibiotics is restricted to patients who are critically ill, who have a demonstrated hypersensitivity to the V-lactams, or who are infected with V-lactam-resistant species. They exhibit a narrow spectrum of action and are bactericidal only against the enterococci. Oral preparations of vancomycin are available, however they are not absorbed from the lumen of the gut, formulated for the treatment of infections within the gastrointestinal tract, Clostridium difficile. Vancomycin side effects. Vancomycin is usually given intravenously as an infusion and can cause tissue necrosis and phlebitis at the injection site. Red man syndrome, an idiosyncratic reaction to bolus dose caused by histamine release. Nephrotoxicity, including renal failure and interstitial nephritis. Blood disorders, including neutropenia and deafness, which is reversible once therapy is stopped. Risk of accumulation in patients with renal impairment. Streptogramins. Effective in the treatment of vancomycin-resistant Staphylococcus aureus, VRSA, and vancomycin-resistant Enterococcus, VRE, two of the most rapidly growing strains of multi-drug-resistant bacteria. Members include quinupristin, dalfopristin, pristinamycin, virginiamycin. Adverse effects include related to administration via peripheral vein, inflammation, pain, edema, infusion, site reaction, thrombophlebitis, non-venous adverse effects, nausea, vomiting, diarrhea, rash, headache, pain, ill-defined, focal or generalized discomfort, pruritus, arthralgia, myalgia, asthenia, conjugated hyperbilirubinemia, Oxazolidinones, e.g., linezolid. Linezolid inhibits ribosomal protein synthesis by inhibiting formation of the initiation complex. It is used for the treatment of serious infections caused by gram-positive bacteria that are resistant to several other antibiotics. Linezolid is active against most gram-positive bacteria that cause disease, including streptococci, vancomycin-resistant Enterococci, VRE, and methicillin-resistant Staphylococcus aureus, MRSA. The main indications of linezolid are infections of the skin and soft tissues and pneumonia, particularly hospital-acquired pneumonia. Common adverse effects of short-term use include headache, diarrhea, and nausea. Long-term use, however, has been associated with serious adverse effects. Linezolid can cause bone marrow suppression and low platelet counts, particularly when used for more than 2 weeks. If used for longer periods still, it may cause sometimes irreversible chemotherapy. Induced peripheral neuropathy and optic nerve damage and lactic acidosis. Ansamycins. A family of secondary metabolites that show antimicrobial activity against many gram-positive and some gram-negative bacteria, and includes various compounds, among which streptovaricins and rifamycins. Rifamycins are a subclass of ansamycins with high potency against mycobacteria. This resulted in their widespread use in the treatment of tuberculosis, leprosy, and AIDS-related mycobacterial infections. The antibacterial activity of rifamycins relies on the inhibition of bacterial DNA-dependent RNA synthesis. This is due to the high affinity of rifamycins for the prokaryotic RNA polymerase. Adverse effects include hepatotoxic hepatitis, liver failure in severe respiratory breathlessness, cutaneous flushing, pruritus, rash, redness and watering eyes, abdominal nausea, vomiting, abdominal cramps, with or without diarrhea, flu-like symptoms, with chills, fever, headache, arthralgia, and malaise. Rifampin has good penetration into the brain, and this may directly explain some malaise and dysphoria in a minority of users. Rifaximin is a semi-synthetic antibiotic based on rifamycin. It has poor oral bioavailability, meaning that very little of the drug will be absorbed into the bloodstream when it is taken orally. Rifaximin is used in the treatment of traveler's diarrhea and hepatic encephalopathy. Rifaximin interferes with transcription by binding to the V subunit of bacterial RNA polymerase. Metronidazole, mitroimidazole antibiotic medication used particularly for anaerobic bacteria and protozoa. It is antibacterial against anaerobic organisms, an amebicide, and an antiprotozoal. It inhibits nucleic acid synthesis by disrupting the DNA of microbial cells. This function only occurs when metronidazole is partially reduced, and because this reduction usually happens only in anaerobic cells, it has relatively little effect upon human cells or aerobic bacteria. Metronidazole is primarily used to treat bacterial vaginosis, pelvic inflammatory disease, along with other antibacterials like ceftriaxone, pseudomembranous colitis, aspiration pneumonia, rosacea topical, fungating wounds topical, intra-abdominal infections, lung abscess, gingivitis, amoebiasis, giardiasis, trichomoniasis, and infections caused by susceptible anaerobic organisms such as Bacteroides. It is also often used to eradicate Helicobacter pylori along with other drugs and to prevent infection in people recovering from surgery. Adverse effects include discolored urine, headache, metallic taste, nausea. Metronidazole is classed as pregnancy category B